I hope I'm visible and audible.
Yes. Yeah.
Hi, Alina. How are you?
Hello. I'm good.
Great. So, if you are ready, should we start?
Yes, we can start.
Okay, great. So, a very good afternoon to everyone. I warmly welcome you all to the webinar Empowering Health Wellbeing, Mental Health, and Substance Use Prevention for Women. So, today's webinar is organized under the Viksit Bharat with Nashamuk Bharat Abhiyan and Nai Chetna, the Ministry of Social Justice and Empowerment, which is the nodal ministry for drug demand reduction, actually formulated and launched Nashamuk Bharat Abhiyan on 15th of August 2020, and it's currently being run in all the districts of the country. So these districts were identified based on findings of a comprehensive national survey that was conducted by ministry. The primary objective of the Abhiyan is to raise awareness about the dangers of substance use and promote healthy lifestyle among individuals, families, and communities. It emphasizes the importance of early intervention and prevention programs to discourage the use of substances and protect vulnerable populations, especially the youth. So, coming Nashamuk Bharat Abhiyan, we intend to reach out to the masses and spread awareness about substance abuse through various activities that include but are not limited to first, obviously, awareness generation programs in vulnerable areas. We also focus on higher educational institutions, university campuses, schools. We reach out to community, identify dependent populations, and support them. We focus on counseling and treatment facilities in hospitals and rehabilitation centers, and they all have been geotagged. So we'll discuss about that all in our coming presentation. And we also organize capacity building programs for service providers in different geographies. Now coming to Nai Chetna is a campaign launched by the Ministry of Rural Development to encourage rural communities to become self-reliant, empowered, and gender aware. A primary issue impacting the lives of women and persons of marginalized genders is that of gender-based violence, from intimate partner violence to violence in public spaces. Gender becomes a key factor in deciding how people are treated. It is therefore critical to ensure continuous work to combat the issue of gender-based violence. The National Rural Livelihood Mission, under the MORD, through its gender interventions, has been making strategized efforts to address the issues. Hence, a month-long campaign was also designed to create a concerted effort in acknowledging, identifying, and address issues of violence. The Ministry of Social Justice and Empowerment expresses its heartfelt support in endorsing Nai Chetna's mission and actively engaging in the campaign. Now, before we start with the webinar and discussion, we would like to share a PPT on the Shamak Bharat Abhiyan and Nai Chetna for more detailed information. So I'll just share my screen for a moment. I hope it's visible. Okay, great. So as we discussed, under the Shamak Bharat Abhiyan, we are organizing this event with Nai Chetna. Some of the major stakeholders for the Shamak Bharat Abhiyan include youth, women, as we are very focusing towards women and gender-based violence in this campaign. We also focus on educational institutions, community, civil society organizations. Now, to the youth participation, we try to harness the youth potential in productive activities rather engaging in substance use or other harmful activities. We also make some youth as ambassadors of change and role models for their peers. We use social media extensively for youth engagement. For women participation, we have provided definitive sense of direction as women are the foremost leader taking the campaign in their geographies, different geographies, and they utilize persuasiveness in family settings for understanding the challenges of substance use. And we are also promoting women self-help groups and local groups, their participation to lead the campaign and door-to-door awareness drives by ASHA, Anganwadi workers, and many other women groups. Now, coming to Nai Chetna goal, actually, it's focused on advancing the agency and rights of women and genders diverse individuals. So we can address the structural barriers and they can have a dignified living without any kind of fear or discrimination or violence based on their gender or intersectional identities. As we are aware from multiple surveys, however, I would like to quote a few. Uh, more than 80%, 87% of addicts that were being treated in de-addiction center run by Delhi police, they reported having been violent in family members. And to the latest NFHS, the fifth round, we can see that as many as 77% women never sought any help for anyone about the violence inflicted on them. So there may be multiple reasons. However, the more we promote and aware people about it, the more it will come out and we will be able to help them. Now, the brief of campaign, the Nai Chetna campaign, it's an annual campaign with a broad theme of gender-based discrimination and how we can support people against like fighting against it. It has a period from 25th November to 23rd December, also including International Day of Elimination of Violence Against Women. We have target group as community, FLWs, line departments, PRIs, CSOs, and especially our major target, including finding women beneficiaries and stakeholders among all such target groups. And it is being implemented by a bucket of activities for all states and line departments and mandatory activities to be conducted at community level. Now, again, coming to how we are engaging NMBA and women or youth participation in this. So far, we have covered more than 3 lakh educational institutions with higher scope of positive influence. And we are also trying to create drug-free clubs which are led by students. So they can be aware and they can stop such activities in their family or in their surroundings. For community ownership is very important for us. So we are trying to make it in a way so that community takes the ownership and it provides the sustainability to our campaigns against substance use and violence against gender. And now we have awareness vans, we have citywide community campaigns. We also organize a national oath in educational institutions. So in that national oath campaign, in one day, around 1.67 crore students participated and around 99,000 educational institutions participated and organized the oath campaign. And with the oath campaign, they made students aware about what kind of challenges we are facing and how we need to stand together to combat all of this. There was this one interaction with the National Cadet Corps. The cadets were more than 40,000 cadets joined online across the country. It was blessed from our defense minister, Mr. Rajnath Singh. We also have master volunteers, more than 8,000 uh, working rigorously to spread the message of Abhiyan. They come from diverse backgrounds like education, youth sports, women child development, legal services, enforcement, and they all work they all try to assist other volunteers who are working in different capacities within their districts. We also use social media and digital intervention, as I earlier discussed. We organize multiple posts, memes, multiple updates, and we also have a website and mobile app on the Shamuk Bharat Abhiyan that provides real-time data and master volunteers and district and state officials can fill data in this. As I discussed earlier, we have the website. It has IEC, BCC material in different languages. We have expert forum and discussion page for people who need help related substance use and they want to um make their healthier life choices. They can come and ask specific questions to our experts. We have pledge section for citizens and recovered substance users. We also have citizens corner with feedback and grievance. Now, coming to some of the intervention, on-field intervention that are being sponsored by our ministry. The first one is obviously community-based peer-led intervention. It's for early drug prevention, and it targets adolescents from 10 to 17 years. So, as these are some of the most formative years for in the life of any kid, so we try to identify these youth as peer educators and peer volunteers. We take the ministry sponsored organizations. They take behavioral change communication sessions. They provide training to youth, and they also do the counseling as well as referral services to service centers, which are also sponsored by our ministry. We have outreach and drop-in center. These are safe and secure space. They provide screening, assessment, counseling for substance use disorder, and they also provide referral and linkages with other treatment facilities in case something that comes up which is beyond their capacity to accommodate at that moment. And we also have treatment and rehabilitation services. So I would like to mention once that all the services in all these centers are provided free of cost, completely sponsored by our ministry. So if anyone comes up and they need help related to substance use, or their family or their loved one needs help, it all will be completely sponsored and provided fully free of cost by the ministry. Now coming to our treatment and rehabilitation part, because we believe that rehabilitation is equally important as well as the treatment. So we have a structure for that. First, obviously, the primary screening and assessment. Then coming the medical treatment and referrals. We have counseling, both individual and group. We also provide recreational activities, because if someone is staying at a center for a month long de-addiction service, they also need some time to get engaged in recreation. We also provide family counseling and follow-up after care. So it's a whole package that is taken care by ministry sponsored organizations. Ministry also runs a national de-addiction helpline number. It's 24 cross 7 dedicated available. And the number is 14446. It provides primary counseling. It also helps someone find the nearest de-addiction and counseling facility. It also helps people to collect intelligence on sale of narcotic substances. Let's say if someone wants to inform sale of some narcotic substances or prohibited contrabands, they can call this number and they can share the information without sharing any of their personal data. So all the calls to this number are anonymous. No personal data is asked while someone is calling. So far, we have received 3 lakh calls, and 52% of callers are from a very interesting group of 21 to 30 years. It's a very young group. And so far, we have also seen 15% callers are women. And we really believe it will be a very high number if women are more aware about the kind of services that are available to support them. Thank you for that. Now, I'll just stop sharing my screen. I guess it's fine. Um, just a second. Okay, great. So I hope it was an informative presentation about the kind of services that are available to support our beneficiaries across the nation, as well as the kind of challenges that we are facing. However, with the support of community, we are trying to go beyond these challenges and make a healthy and drug-free India. Now coming back for today's webinar, as resource person, we have with us Miss Elena George. Ms. George serves as the co-founder of Project Unlearn Initiative. Project is dedicated to engaging with males to mitigate instances of crime and violence perpetrated against women. Her work spans across communities and prisons within the Delhi and NCR region. She specializes in the creation and execution of bespoke programs that envision environments devoid of violence and crime against women. With a professional experience of 6 years in the development sector, she brings a wealth of knowledge to her role. She also holds a master's degree in sociology from Ambedkar University, Delhi. Furthermore, she has been recognized as a fellow by several prestigious programs, including Second Chance, SSC, Unlimited, Change Loom, and Kritika. We encourage our resource person, Miss Alina, to utilize the platform to enlighten our participants about the impact of substance use on the psyche of women and measures that can be taken up to improve their mental well-being and how to overcome violence and sensitize other towards gender-based violence, followed by a round of some question answers that will be coming from the crowd that is joining us today. So, Miss Alina, if you want, we can share the presentation. Is it fine?
Yes, thank you so much, Adarsh. You can share the screen and I'll be happy to take it forward. Well, thank you to Nasha Mukt Bharat Abhiyan team and Ministry of Social Justice of Empowerment for giving me an opportunity to talk about Project Unlearn, which is very close to my heart. And I truly believe in its potential. So, Project Unlearn is an initiative which works with men to end gender based violence and crime in India. The seeds were sown in 2017 when I got an opportunity to work, to enter Delhi prisons, to interact with male prisoners, to understand the dynamics of the prison, and engage men in the prisons. Before I further talk about Project Unlearn, I would like to talk about the NCRB reports. We can move to the next slide. Yeah. So you all might have uh, seen the NCRB report, which actually talks about that in the year 2022, around 4 lakh rape, crime against women FIR were registered. And India records that 51 cases of crime against women every hour. And for some reason, every time Delhi tops the list and followed by Mumbai and Bangalore. And these numbers are based on only the reported cases. As Adarsh had also highlighted, that a good amount of cases also go unreported. Um, I would want everyone to understand that these numbers have now become so normalized and so normal in our everyday life that we do not really work towards it in our full potential. But I think it's never too late. Uh, and we can all work together to reduce these numbers. I would like to highlight the first 3 years of Project Unlearn. Moving to the next slide. Yeah. So in the first 3 years, we got an opportunity to talk with 300 plus perpetrators of crime and violence against women housed in jail number 5 in Tihar prisons. During this entire conversation with 300 plus inmates, this was done to understand the influencing factors of crime, to understand the demographics and hotspots in Delhi, to understand their experiences and to do a primary research and to develop a program based on the study that we had done. Moving to the next slide. So the methodology that was used, we were a team of 66 people, and during the 37 months, we had 120 hours of focus group discussions in the prisons. We had 200 plus personal interviews with the perpetrators. We had series of workshops and sessions on gender-based violence and crime. We did baseline surveys. There were 30 plus group counselings happening in Tihar prisons, and we had invited guests and experts from outside to initiate a dialogue on these topics. Moving to the next slide. So the 300 plus perpetrators that we had interacted with, 76% of them were under trials. That means that their cases are still going on, and they were not convicted. 21% of them were repeat offenders. So as you can see in this pie chart, rape, POXO, molestation, sexual harassment were one of the major crimes that they were accused of. And we had also, in the next slide, I'm going to talk about the influencing factors that they had mentioned. We can move to the next slide. Yeah, influencing factors. When we had interactions with them, alcohol and drug abuse was one of the major reasons that they had highlighted. And based on their narratives, we understood that male entitlement or hypermasculinity or toxic masculinity, however you want to word it, was another reason why they had ended up with the kind of action that they had done. Peer influence and alcohol abuse is somewhere interlinked. Everything is interlinked, but peer influence was another major reason why they ended up doing whatever they were accused of. And based on these studies and influencing factors, we developed a program. We understood that it is important to talk to men, to create safe spaces for men so that they can understand the consequences, the legal repercussions of their actions. So that is how I created and started Project Unlearn. We created a separate curriculum. We can move to the next slide, which where I can talk. Yeah. Or okay, before that, let's talk about substance abuse as one of the reasons. Nowhere in my study or in our research, we are saying that this could be used as an excuse for someone to perpetuate violence. This is still a conscious decision made by men who engage in such behavior. So this cannot be like a sole underlining thing that बिकॉज़ वो इंसान ड्रग्स या नशे करता था तो इस कारण उसने कोई भी क्राइम अगेंस्ट वुमेन करा है बट नॉट बट इट इज वी कैन नॉट डिसमिस द फैक्ट कि नशे करने से अगर वो लगातार नशे कर रहा है तो चांसेस है कि उसका डिसीजन मेकिंग थोड़ा कम हो सकता है इट डिसरप्ट्स हिज थिंकिंग वो एज एन एक्सक्यूज देने लग जाता है और वो डोमेस्टिक वायलेंस में बहुत मेजर रोल प्ले करता है तो इससे हम लोगों ने बैठ के एक पूरा करिकुलम डेवलप करा co-create kara with inmates who talk about these issues. Moving to the next slide. Yeah. So the idea was to create gender lens in men. उनको क्राइम की रिस्पॉन्सिबिलिटी के बारे में बताना सिर्फ जेलों में नहीं काम करना बट हाई क्राइम नेबरहुड्स में काम करना क्योंकि हमारे डेटा में हम लोग वो सब हाईलाइट कर पाए थे कि दिल्ली में ऐसे कौन से हॉटस्पॉट्स है और ऐसे कौन से नेबरहुड्स हैं जहां काम करना जरूरी है rather than waiting for these men to be accused and get and them entering the prison. दूसरा कि इनके साथ बात कौन करेगा इन मुद्दों के बारे में and the best that we were able to come up with were ex-inmates who were accused of these crimes. They were the best people who could initiate a dialogue on these topics. तो इसके थ्रू हम लोगों ने एक करिकुलम बनाया जिसका नाम पहल है एंड वी कैन मूव टू द नेक्स्ट स्लाइड तो इन मुद्दों पर बात करने के लिए हमने सब कुछ गेमिफाई कर दिया क्योंकि हम प्रिजन्स में काम करने की बात कर रहे हैं मोस्ट ऑफ देम आर अनलेटर्ड most of them do not have a good attention span और सिंपल जैसे मेन स्ट्रीम स्कूल्स में पढ़ाई होती है तो वैसे पढ़ाई नहीं हो सकती है जेलों में तो हम लोगों ने सब कुछ गेमिफाई करा इट्स अ 45 hour curriculum co-curated with inmates जो 300 प्लस inmates के साथ हमने काम करा है उनकी सपोर्ट से हमने ये करिकुलम बनाया है और इसमें बहुत सारे गेम्स हैं जैसे कि आप इसमें देख सकते हैं मैं कुछ गेम्स के बारे में मैं आपको अगले स्लाइड में बताना चाहूंगी वी कैन मूव टू द नेक्स्ट स्लाइड ग्रेट तो जैसे पहल हम इस करिकुलम को कहते हैं जिसमें हम लोग 7 मेजर थीम्स को कवर करते हैं जेंडर एंड सेक्स टॉक्सिक मैस्कुलिनिटी इंटरसेक्शन ऑफ वायलेंस एंड क्राइम डाउरी डोमेस्टिक वायलेंस ये सारे चीजें जो यूजुअली इन स्पेसेस में लड़कों के साथ नहीं बात करी जाती हम उन स्पेसेस में इन टॉपिक्स पर खुल के बात करते हैं एंटायरली एक्टिविटी बेस्ड जैसा कि आप सेकंड उसमें देख सकते हैं ये एक स्नेक एंड लैडर है जो हम लोगों ने अंदर क्रिएट करा है इट्स अ फ्लोर गेम जिसके ऊपर लोग खड़े होकर खेलते हैं और इसके थ्रू हम लोग सेक्सुअल कंसेंट के बारे में बात करते हैं इसमें छोटे छोटे सिचुएशंस दिए हुए हैं जो रियल लाइफ स्टोरी से हैं जैसे कि अगर एग्जाम्पल के तौर पे बोलूं लड़की के हाँ लड़की के नाम में भी हाँ है या हंसी तो फंसी तो हम इस गेम के थ्रू हम लोग सेक्सुअल कंसेंट के बारे में बात करते हैं There are card games which talks about rights and responsibilities of a good citizen. There are comic books which talks about dowry, domestic violence, POXO, और ये जितने भी comic books बने हैं वो real life कहानियों से बनी हैं जिनसे हमारा interviews और interaction हुआ था prisons में. तो इन टूल्स एजुकेशन टूल्स के थ्रू हमारा मानना है कि अगर हम लड़कों को वो स्पेस दे पाए टू टॉक अबाउट दीज इश्यूज, टू टॉक अबाउट रिलेशनशिप्स, टू टॉक अबाउट हाउ दे फील अबाउट बीइंग अ मैन, और जितने भी जेंडर बेस्ड नोशंस हैं, मिथ्स है, उनको तोड़ने के लिए और वो एक कॉन्शियस डिसीजन ले अपने एक्शंस के लिए, हम वो कोशिश करते हैं जेलों में और हाई क्राइम नेबरहुड्स में. We can move to the next slide. तो आज की डेट में हम लोग दिल्ली प्रिजन्स में काम करते हैं, जेल नंबर 5, जेल नंबर 4. देहरादून में 2 प्रिजन्स में हम लोग काम करते हैं, ऑब्जर्वेशन होम्स में काम करते हैं और हाई क्राइम नेबरहुड्स में काम करते हैं. और जैसे कि मैंने कहा हमारे पूरे इंटरवेंशन में मेन लोग हैं एक्स इनमेट्स, जो लोग जेल से बाहर निकल कर चाहे वो अक्यूज, चाहे उनका केस अब भी चल रहा हो या नहीं, उससे फर्क नहीं पड़ा है हमें कभी, बट द आइडिया दैट दे आर रियली पैशनेट टू इवन वर्क टुवर्ड्स दिस, सो वी ट्रेन देम टू बिकम फैसिलिटेटर्स and they further conduct sessions in their community in these areas that we work. तो अभी 6 साल के काम में हमने 4,500 प्रिजनर्स के साथ काम किया है. और करेक्शनल इंस्टीट्यूशंस जैसे हमने कहा जुवेनाइल होम्स एंड प्रिजन्स, और 35 मेल प्रिजनर्स को हमने ट्रेन करा है टू बिकम फैसिलिटेटर्स, और 1,500 लोग हमारे साथ हाई क्राइम नेबरहुड्स में एंगेज्ड है. Yeah, so that is overall what Project Unlearn believes in, creating safe spaces for men so that we can talk and initiate dialogues on such topics. Yeah. Um, Great. That's the last. Yeah. I'm open for questions as well. You're on mute, Adarsh.
Okay, I was just saying thank you, Alina. It was insightful to hear about your experiences and about Project Unlearn and how they are engaging the people from uh, with these experiences and then helping you out, making these type of small tools and gamify the things. I hope
Mhm.
our audience will definitely benefit from this webinar. So we have a very few specific questions that are coming from our audience, and I hope it will help like our audience to understand the nuances from today's conversation more clearly. So, like you already share something from Project Unlearn. Can you share some more examples of successful programs or interventions that have effectively addressed both substance use and gender-based violence in the context of women's empowerment? If you
I
have
think
any other.
uh, other programs, I think uh, there are a lot of organizations that work in observation homes, जो इन मुद्दों पे बात करते हैं. They especially talk about masculinity. Peer pressure में जब लोग या लड़के ड्रग्स का इस्तेमाल करते हैं या इन यूथ में रेजिस्ट नहीं कर पाते, तो उस मुद्दे को वो लोग एड्रेस करते हुए उनको बताते हैं कि भाई आपका डिसीजन आपका होना चाहिए एंड यू कैन नॉट सिंपली ब्लेम other um, other elements in your life. तो आई थिंक मैंने ऑब्जर्वेशन होम्स में काफी अच्छा इंटरवेंशन देखा है इसके इस पे कई ऑर्गेनाइजेशंस का. या
And in case of juvenile homes, you have also discussed that you also work with juvenile homes. Were there any specific region or any specific kind of challenges that you faced while talking to convicts, or I should not use the word convict, the the persons who are in juvenile homes and they
Mhm.
are currently staying there? What were specific challenges that you faced while talking to them?
I think one is the limited resources that we are allowed in such settings. हम बहुत सारी चीजें हैं जो नहीं लेके जा सकते इन सेटिंग्स में, बट जैसे कि एवी मटेरियल्स नहीं लेके जा सकते, तो वील हैव टू स्टिक टू बुक्स एंड पेन्स एंड क्रेयॉन्स. दूसरा, इंटरेक्शन विद देम. मोस्ट ऑफ द स्टूडेंट्स दैट वी हैड मेट इनसाइड, उनका एम है कि वो बड़े प्रिजन में जाए. उनका उनका मोटिवेशन है कि वो बड़े प्रिजन्स में जाए, और that has become their goal, and they cannot think of an alternative goal in their life, and they really need that. और दूसरा चीज जो मुझे समझ आया कि a lot of family support is needed, क्योंकि जुवेनाइल होम्स या इन प्रिजन्स हमारे साथ उनका इंटरेक्शन 1 महीना या 2 महीना रहेगा, बट वंस दे स्टेप आउट ऑफ द प्रिजन दे विल बी बैक इन द सेम सोसाइटी. तो वो स्टिग्मा और जो टैबू वो लोग लेके चलते हैं, वो एक्सेप्ट, अगर सोसाइटी उनको एक्सेप्ट ना करे, सो द चांसेस ऑफ देम कमिंग बैक टू द सिस्टम इज प्रीटी हाई. और family has an important role to play, friend circles have important role to play here. तो हमने वो कई बार देखा है. In fact, in our data also we had mentioned that 21% of them were repeat offenders. तो तो चाहे वो करेक्शनल इंस्टीट्यूशन जिसको हम कहते हैं, चाहे वो ऑब्जर्वेशन होम ये हो या जेल्स हो, वहां जाने के बाद भी अगर कोई इंसान निकलने के बाद अगर वो वापस आ रहा है, सो दैट मीन्स हमारे करेक्शनल फैसिलिटीज में कुछ कोई कोई गैप है जो हमें फिल करने की जरूरत है. एंड क्लियरली बाहर जाने के बाद दे नीड हैंड होल्डिंग, so that they do not come back to the society, come back to the jail, and they have more motivations to be outside.
Oh, great. So definitely, like juvenile homes has a very different kind of setup as you discussed. There are multiple restrictions at the same time. I believe we also have the highest potential
Hmm.
to make them a responsible citizen in case they learn from us and from other productive activities if they get engaged after coming out of the homes or such prisons. Definitely, if they engage in productive activities, they might be a responsible citizen of our nation and they will be helpful for the growth. So another thing which I have just checked from our listeners is that um, can you share some key challenges which your Project Unlearn faced while implementing initiatives that aim to prevent substance use and promote women's well-being simultaneously?
Hmm. I think, like I had previously mentioned in my answer as well, one is the resource. Limited resources are allowed in these settings. Plus, once they step out, I think हम लोग खुद नहीं टैप कर पाते कि कौन सा इनमेट कहाँ जा रहा है. तो वो डेटा हमारे पास अवेलेबल नहीं है, एंड दे नीड अ लॉट ऑफ हैंड होल्डिंग. तो अगर अ, जैसे कई सारे इंस्टीट्यूशंस स्किल बिल्डिंग की बात करते हैं. स्किल बिल्डिंग तो बहुत इम्पोर्टेंट है. इट विल डेफिनेटली फेच देम लाइवलीहुड वंस दे स्टेप आउट, बट लाइफ स्किल्स वाला एस्पेक्ट कहीं इंस्टीट्यूशंस में मिसिंग है. कि वो भी अगर हम उनको दे पाए, सो दे विल डेफिनेटली गेट अ जॉब, एंड दे विल आल्सो नो हाउ टू एंगेज विद देयर कलीग्स इन दीज स्पेसेस. तो काम तो मिल जाएगा, बट उनका रिलेशनशिप विद देयर कलीग्स अगर सही नहीं हो, सो या विद, लेट्स से फॉर दैट मैटर फॉर women in their field, they might end up causing harm to them again. या वो चैलेंज एक आया है, और दूसरा मेरे हिसाब से फंडिंग हैज बीन वन. विथ लिमिटेड रिसोर्सेज हम लोग जब प्रिजन्स में जाते हैं, सो वी विल हैव टू इंश्योर कि हम लोग अपने रिसोर्सेज को फुल पोटेंशियल में यूज करें. और security is one main thing that every institution has, like a primary thing. So we have to ensure कि हम उसको भी cater करते हुए इन spaces में enter करें. और yeah, I think these are the major challenges. Yeah.
Great deal about that. Definitely, because as a nation, we are a complex mix of multiple cultural considerations and nuances that come in India. And multiple times, uh, many reports also say sometimes some specific cultural appropriations or nuances that come up for such kind of crimes or such kind of substance use activities or violence. So, are there any specific nuances that should be taken into account while designing interventions for women empowerment in relation to substance use and gender-based violence?
uh, any intervention would require a contextual lens, चाहे वो language हो, चाहे वो उनका सोशो इकोनॉमिक बैकग्राउंड हो. अगर मैं अनलर्न की ही बात करूं, जो कंटेंट हमने बनाया है विद द हेल्प ऑफ इनमेट्स, वो लड़कों के साथ बहुत ही बढ़िया तरीके से फिट हो सकता है, बट इफ आई हैव टू यूज दिस विद विमेन, शायद वो पूरी तरीके से फिट ना हो. एंड जो एग्जाम्पल्स हम लोग यूज करना चाहेंगे फॉर द प्रोग्राम्स, दैट नीड्स टू बी मोर पर्सनल to the kind of beneficiaries that we are targeting. Um, क्योंकि आई डोंट थिंक एक सिंपल ड्रग्स से रिलेटेड एक ओपन करिकुलम वुड फिट every set of beneficiaries. We have to contextualize it. We'll have to help motivate the individuals, the beneficiaries, to understand कि उसमें से वो क्या लेके जा रहे हैं. That is more important. So I think every intervention needs to be more contextual based on the set of beneficiaries that we are targeting. Yeah.
Like um, definitely, like context plays a role. While let's say you were saying you designed your curriculum and it may fit way better for boys than
Hmm.
working with women or girls.
Hmm. Hmm.
So when looking at the macro lens of policy or such interventions that are done by governments uh, and different departments, uh, like can you suggest like what kind of policy intervention or safeguards should be in place to reduce or let's say end the correlation of substance use and violence, gender-based violence? Is there any macro level suggestion that you might provide to our audience?
I think one would be to have the primary beneficiaries in a decision-making role, to make them leaders in the community. और अगर वो लोग अपने experiences से अगर बता पाए कि उनको क्या policy level पर change चाहिए, uh, वो लोग they can be better advocates around that. I'm not sure if I can think about what exactly needs to be changed in policy as of now from my lens. Um, जैसे, no, I'm not sure if I can think of an answer. Yeah.
That's perfectly fine. I believe definitely that point of uh, bringing stakeholders for the policy decision-making process and engaging them in that will definitely provide us very, very different kind of lens to see these challenges and how to go about it. So, but again, whenever a policy is structured, uh, we often have two lenses, like I earlier talked about macro lens and the micro lens, which is coming from the beneficiary side or whoever would be targeted stakeholder in our intervention. So, but again, do you believe that the role of society as a whole or the civil society organizations that maybe, the voices of the society, uh, how they can play a very crucial role in making safe space for both men and women to come out and share the challenges that they are facing so that the end result should not be like any correlation between gender-based violence or any harmful thing that is a result of substance use. Because also from your survey, we found out the major portion was that they were saying they were consuming some sort of substance or maybe alcohol, and that is a major reason for the violence, whatever is happening at domestically or other locations. So, as a civil society organization or as a whole society, what kind of role should we play and how we should start, uh, talking about it so that people can become comfortable and then maybe we will be able to reduce it. Can you suggest something,
Mhm.
please?
I think, like you're suggesting, interaction with these youth, चाहे वो स्कूल में ही क्यों ना हो, आज मतलब स्कूल इज वन ऑफ द एरिया जहाँ से लोग इन सब ड्रग्स के बारे में या इन सब एरियाज के बारे में डिस्कस करना शुरू करते हैं. We have good amount of social media. We have OTT, which talks about drugs, which highlights drugs in a different light. अगर हम लोग इसके बारे में openly बात कर पाए, like as parents, as peers, या स्कूल्स में ऐसा डिस्कशंस होना शुरू हो जाए, नॉट विद द आइडिया कि अगर हम इसके बारे में बात करें तो उनको ज्यादा ज्ञान हो जाएगा, बट विद द आइडिया दैट इट इज इम्पोर्टेंट कि हम वो इशू एड्रेस करें. और अगर बाय एनी चांस कोई कोई स्टूडेंट या कोई इंडिविजुअल अब्यूज कर रहा है ड्रग्स को, या वो, to try to understand the primary or the base reason on why the person has reached that stage, rather than usko society se cut off karna, उससे और interact, like there is a reason to why a person will end up using drugs, because शायद उसको वो safe space society में नहीं मिल रहा है, और for some other reason. But अगर उसको एक alternative मिल जाता है from the society, things can change. I think वो platforms create करना ज़्यादा important है, and society has a major role to play. More movies around not highlighting drug use, but propagating the idea that such usage can hinder their health and their mindsets and decision making. Um, it can also play a role. Yeah. You are on mute, I guess.
These were the major questions that were asked by our audiences today, and I believe we had a very broad conversation about the different kind of challenges and the kind of suggestions that can be taken up by as an individual or as a policymaker from our end at the ministry. So now coming to the end for today's session, I on behalf of the entire team of Nashamuk Bharat Abhiyan would like to thank you, Alina, for providing your precious time in making today's webinar a
Thank
success.
you.
I would also like to thank our audience for their dedicated efforts to our Abhiyan and especially asking very interesting questions so that we can move the conversation further ahead and start talking about it in their family, in their schools. We wish everyone all the very best and hope that the efforts to make a drug sensitized nation will continue to be stronger in future. We also continue organizing many such events to spread the message of Abhiyan to the masses. So I hope everyone stay engaged with our social media to learn about such more, many more such events that we will be organizing in future. Now, for a moment, I would request everyone to open their cameras and we can have a group photo for a moment. That would all go into our social media channels. Risha, please let me know when it's done.
Thank you so much. It's done.
Oh, thank you, Alina, and thank you everyone for joining us today and sharing your insights, Alina. It's definitely important to talk about it and engage the people who were actually sort of convicted because of this. It's very important to understand it from their lens and then making solutions with them. So in future, nobody should get engaged in such kind of activity, and definitely it will be helpful for both our audience as well as if we go further in into any other training programs, we will definitely try to engage them in the method that you developed and we really hope to have such bright collaborations in future also. Thank you, Alina. Thank you, everyone.
Thank you. Thank you so much.